And welcome into our business spotlight here on this Friday morning. That spot is reserved for the folks at Morris Hospital. And this morning we have in studio Dr. Isaac Mezo, a neurologist at the hospital. Doctor, thanks for joining us. How are you?
Thank you. I'm very good. Thank you, Mike. I'm glad to be here.
Yeah, we're going to be talking today about Parkinson's disease, as April is Parkinson's Disease Awareness Month and April 11th, World Parkinson's Day. So everybody's probably heard the term. Maybe just a quick explanation what Parkinson's disease is.
Sure. Parkinson's disease is a neurodegenerative condition. What happens is there's a part of the brain called the substantia nigra, and it starts dying off over time. It produces less and less of a chemical in the brain called dopamine, which makes it hard for people to move smoothly, walk smoothly, talk smoothly, and that's what Parkinson's disease is.
And what are some of the causes, I guess, that would lead to this?
Sure. Well, we don't really know of a specific cause for Parkinson's. There are many theories. Some have been linked to things like Agent Orange over in Vietnam. They've been linked to other lifestyle problems with people. However, we really don't know. We know that it is neurodegenerative. Over time, it's going to get worse. And we do have some therapy, not necessarily to slow the disease down, but simply to make life easier for people.
How common is Parkinson's disease?
It's actually common enough. We have about 7 to 10 million people worldwide who are affected by this. It's the second most common neurodegenerative disease after Alzheimer's dementia.
All right, so we've talked a little bit about some of the possible causes, really no defined causes. What about symptoms? What should people be looking for?
Sure. The most common symptom that most people know about is a resting tremor. A tremor on one side of the body, specifically an arm, be it the left or the right, that is worse whenever your arm is just laying at rest, not when you move it. That's the most common symptom, but really you could have rigidity, meaning your muscles are rigid and spastic. Number two, something that we call Brady Kanisha, when you don't move very smoothly. You don't blink as much. You have to turn your whole body to turn your head. And then as time goes on, you develop gait instability. You can't walk as well. You tend to fall. You're more prone to any kind of gait imbalance. And really, a lot of other diseases can mimic Parkinson's disease. So it's very important to get evaluated by a physician who's able to tell, yes, this is Parkinson's, no, this is something else.
And obviously, the sooner the better if you are experiencing some of these symptoms. What would some of the treatment options be for someone, say they come in to the hospital and they think they have some of these symptoms?
We don't have a therapy that will cure Parkinson's, but the medications and the other therapies that we use certainly make one's life easier. For example, we have a medication which replaces the chemical dopamine in the brain that's depleted. This medication helps with the motor symptoms of Parkinson's disease, helps with the rigidity, with the tremor. We send patients to physical therapy, which helps them with gait training. There's speech therapy because speech is also affected with Parkinson's disease. And most interestingly, we have something called a deep brain stimulator. That is an implant that can be placed in the brain, and it works like a pacemaker where it's able to control your movements. And patients are even able to come off medications with these deep brain stimulators. It's something that a lot of patients are getting good benefit from and are controlling their symptoms much better than some of these medications.
So it could stabilize things. Like you said, it won't cure.
That's
but it
right.
Might help prevent it from getting worse, or
That's
at least
right.
slow it down.
It is slow. It slows it down, and it makes the morbidity associated with the disease more manageable.
All right. So if you think you have symptoms or you want to find out more, you can go to Morris Hospital. They've got neurology specialists at the Morris office, 1499 Lakewood Drive, Suite I in Morris. In Shanahan Healthcare Center of Morris Hospital on Reed Street, and you can always call to get an appointment in Morris at 942-4506 and in Shanahan 467-0555. We want to thank Dr. Isaac Mezo for coming in and giving us some information on Parkinson's disease. Doctor, thanks for your time this morning.
Thank you, Mac. I'm glad to be here.
That's our Business Spotlight, heard every Friday at this time in conjunction with the folks at Morris Hospital here on WCSJ.